Good afternoon, everyone. So I'm presenting on how to examine a toddler. So when the child is at your
Full screen.
Make it full screen, please.
Yes.
when the child is first at your clinic, first try to just examine the child as the child is. So when you're taking an history from the parents, try to just look at the child to know whether the child has ocular alignments, the facial disfigurement is there or no. If there is any abnormal head posture, any epicanthal fold, any lid abnormalities, so that you can know what you really have to go in and see when you start examining, because it's really difficult to examine a child if then you start deciding what you have to do. Look out if there's any tearing, any clouding of the cornea, any nystagmus if present. Pupillary responses is seen little later stage. So the first thing after the history has been taken, try to just take your ophthalmoscope and just try to go and see the red reflex, so that you know whether there is any ocular media abnormalities are there, and whether the reflexes are fine in both the eyes, so that you know what you should expect when you see the vision, whether there will be similar vision in both eyes or there will be any discrepancy in the vision, and how you have to go ahead with which eye to examine first. If you examine the bad eye first, maybe the child will become cranky and not cooperate. So first, always try to see which eye has to be examined by the Brooks reflex, and you will get an idea whether you are dealing with any anisometropia also. So for assessment of vision in the children from approximate 1 to 2 years, there are many tests available. The OKN drum is there, Bok candy head beats are there, worthy ivory ball tests are there, but these tests are really not that informative, because they may sometimes give a overestimation of the vision. So preferential looking tests are the best tests that can be done. In this, tele acuity cards can be used, the league rating cards or the Cardiff cards can be used, VEP also can be used. A 15 prism test is always best to know whether the fixation in both eyes is equal or no, and whether the eyes have equal vision or no. By assessment of 1.5 to 3 years, you will be able to know by the resolution acuity. Lee symbols now can be used because now they have recognition acuity. K pictures are there, HOTV charts or tumbling E charts. Snellen's chart can also be used for children. So basically, a monocular and a binocular test are very important. Cover and cover test has to be done in all the children, those who visit, so that you know whether there is any fixation discrepancy, if there is any myopia in any eye. Pupillary responses have to be examined while you're seeing the examining the eyes, extraocular movements and pursuits do get examined. So they can be looked. Sockets are very difficult to be examined in a child. You need a cooperative and a child who is at a little higher age. Anterior segment examinations are important in each and every child. Please do not miss them. They have to be done either with your handheld slit lamp, or you can have a flying baby position or a Superman position, as we say. Or if the child is cooperative, they can sit at your normal slit lamp and you can examine the child. Fundus examination has to be done for everyone. Look out for the central fixation and the maturation of the macula. Retinoscopy, whether the child is having amblyopia or not having amblyopia, is not a discrepancy. It has to be done for all children to rule out if there is any hypermetropic, higher hypermetropias are there in the child. So all examinations are very important in the children. Please do not miss any of them.